the normal course of evolution, females constitute about 50% of the population. In most human populations, more boys than girls are born. That is, 104 to 106 boys per 100 girls. Mortality rates at every age are slightly greater for boys. Thus, with increasing age, the sex ratio balances out, with a slight overall female dominance. In India, however, according to the 2001 census, for every 1,000 males, there were only 933 females. Over the years, the sex ratio in India, that is, the number of females per 1,000 males, has declined. In 1901, there were 972 females per 1,000 males. The 1981 census shows the ratio to be 962 in the 0 to 6 age group. In 1991, it dropped down to 945. In 2001, it further declined to 927 girls per 1,000 boys. Is there some peculiar quirk of nature that allows only so few girls to be born in this country? Not at all. The only explanation for this significantly lower female ratio is that the girl child in this country is forced to die. Midwives are actually instructed and paid or terrorized to kill newly born female infants. Mothers and daughters get the last and the least portion of food in most homes. Women are rampantly made a target of dowry deaths. Since when have these anti-women perceptions taken hold of our society? One is not sure, but clearly they have been around for long. Ayurveda lists a number of practices that will determine the sex of the fetus after conception and even before conception. Certain days and time are said to be good for acquiring a son. Particular diet and rituals are said to determine the sex of the fetus. Doubtless, this son preference follows from deeply entrenched patriarchal values. Giving birth to a son is regarded a great achievement, whereas giving birth to a daughter is a sin. The son is the heir to the family name and fame. The daughter is already called Paraya Dhan or another's property. Women are seen as a burden till marriage, an expense during marriage, and a welcome departure after marriage. Though the Indian society is mostly patriarchal, it is not reflected in a uniform sex ratio throughout the country. In parts of Punjab, touted as one of the richest states, the child sex ratio has plummeted to an all-time low. While it is 793 for the state, one district, Fatehgarh Sahib, records only 766 girls per 1,000 boys. Kurukshetra in Haryana follows closely at 771. All 10 districts with the lowest child sex ratio are in Punjab and Haryana. Districts in Arunachal Pradesh, Chhattisgarh, and Jammu and Kashmir display the highest child sex ratio, that is, above 1,000. Various studies have been carried out to find some explanation for this difference. Some scholars have pointed out that in wheat-based agriculture, women have very little role, and that this leads to a masculine sex ratio and low status of women in the northern zone. According to them, the South is a rice-based agrarian system, and women play a major role in it. This accounts for the higher status of women in this part of India. However, According to other scholars, this is too simplistic and does not really explain the overall picture. Many think that low status of women is linked with poverty and underdevelopment. A look at the global scenario shows that this may not be true. Many African and Latin American countries, all with varying degrees of poverty and underdevelopment, exhibit normal sex ratios, whereas countries like China and India exhibit gender imbalance irrespective of the level of development. One can see this in our country as well. Maharashtra is one of the most developed states, yet the child sex ratio has declined from 946 in 1991 to 917 in 2001. Again, the prosperous Western Maharashtra shows the worst sex ratio. The child sex ratio in urban areas in the state is 15 points lower than in rural areas. One can say that it is a combination of many economic and socio-cultural factors that has led to son preference. Unfortunately, son preference has assumed dastardly forms, giving females in the house little to eat, providing them the least medical care, forcing girls to drop out of school, harassing daughters-in-law for dowry, and even killing them. But the easiest solution that our patriarchal system has embraced is to nip the problem in the bud.
मला सुरुवातीला एक मुलगी होती पहिली आणि त्यामुळे दुसऱ्या वेळेस परत असं वाटलं मुलगी जर झाली तर त्यापेक्षा म्हणजे मुलगा असला की मुलगा वंशाचा दीपक किंवा मग पुढं म्हातारपणी वगैरे आधार म्हणून असं मुलगाच असावं असं वाटायचं घरी. गर्भपात मी चेकिंग कोल्हापूरला केलं 4 महिने झाल्यानंतर पूर्ण झाले तेव्हा.
पण तिला म्हणजे पुन्हा ते ऑपरेशन करायची मस्त इच्छा नव्हती तिची, परंतु नाईलाज झाला कारण घरची लोक म्हणायची की नाही मुलगा आला तर मग आम्ही दुसरं लग्न करू. मग हे तिला टेन्शन होतं सतत म्हणजे किंवा ती मग दुसरं लग्न केलं तर मग पुन्हा आपलं काय हा प्रश्न होताच तिच्यापुढं. त्याच्यामुळं मग तिला ते म्हणजे पुन्हा म्हणजे करायची पाळी आली ऑपरेशन.
Abortion was legalized in India in 1971. It allowed the Indian woman the right to choose. But it also opened the floodgates to rampant misuse. The figures are frightening. Between 1978 and 82, about 78,000 cases of post-amniocentesis abortions occurred because the fetus was female. We are a classic case where modern science is made to serve age-old prejudices.
Sonography is done in a woman of a childbearing age when she misses a period to confirm whether she is really pregnant, and intrauterine pregnancy can be seen as early as 5 weeks of gestation. Now, sonography is done at various stages of pregnancy. In the first 3 months, it is done to see the number of fetuses. Then, if there is any associated congenital abnormality in the baby, and if the if the mother has any bleeding or any other complication like associated kidney disease, or if there was any past history of abnormal fetus. Now, if the sonography is repeated in the 2nd and 3rd trimester or in the next 3 months and last 3 months of the pregnancy. Now, sonography is not at all done to see the sex of the fetus, but it is done in case the previous pregnancy, for example, if the female fetus in the previous pregnancy had some congenital anomaly and which is likely to be repeated in the next pregnancy. Similarly, if the first male child had some abnormality which is likely to be repeated, then in only those cases sex determination is done.
In 1980, it's very interesting how we stumbled upon the whole issue of sex determination in pregnancy. There was a multinational company in Bombay whose employees' spouses' bills. They didn't employ women, so obviously the spouses were women. the medical bills were suddenly showing up in large quantities, and all of them had a test, sometimes followed by an abortion. And so they called some people that they knew from women's groups, and that's how we stumbled upon this issue that amniocentesis or chorionic villi biopsy, usually amniocentesis, was being conducted. In Punjab and Haryana by then, huge hoardings had started appearing. Pay 500 now and save 5 lakhs later, meaning that you pay for the test and you save on dowry or wedding expenses. Now let's backtrack a little bit. Even though this issue came to the fore in 1980-81, it was all through the 70s that already the All India Institute of Medical Sciences, the premier institute of medicine in India, public institution, had perfected this technique to find out if the fetus was growing well, if there was any growth retardation, etc. Now, when AIIMS started getting requests for sex determination, the government immediately clamped down and said that no sex determination would be conducted in public institutions. So therefore, did the state act out on an act of commission against women in this issue? No. They did not allow any test to be conducted in the public sector. Where they failed, actually, it was an act of omission. They failed to regulate the private sector, and so therefore by the time in 80-81 we stumbled upon the issue, this whole test had gone all over the country. Therefore in Bombay we formed 2 fora. One was the Forum Against Sex Determination and Sex Pre-Selection Techniques, and the second was Doctors Against Sex Pre-Selection and Sex Determination and Sex Pre-Selection Techniques. We must have spoken at 1,000 places, outside railway stations, colleges, schools, wherever we got a chance, we spoke about this issue, to the extent that in Maharashtra, the rumblings had started. The second historic moment was a good health secretary, a very proactive health secretary, Mr. D.T. Joseph, coming in and wanting to do something to remove this discrimination. And so therefore he formed a task force on which I worked, and all through 86 we found out how severe the problem was, what exactly the problem was. And on the 1st of January 1987, the PNDT Act, the Prenatal Diagnostic Techniques Act, was first passed in Maharashtra. Gujarat and Karnataka followed immediately, but it was very easy to pass a sample from Maharashtra into Andhra Pradesh or from Gujarat into Rajasthan. And so therefore a national act was required. We again lobbied, all of us were part of that process, and in 1994, the Government of India passed the Prenatal Diagnostic Techniques Act. Now if we go back a little bit, even while we formed the Forum Against Sex Determination and Sex Pre-Selection Techniques, we were quite aware that sex pre-selection tests had started coming in. Meaning what? That sex determination is after you are pregnant and they find out whether it's a male fetus or a female fetus, but preconception means that separating the male sperms in a way as to give advantage to the male chromosome bearing sperms into the woman's vagina through artificial insemination. And these techniques were already there. And so therefore we wanted these included and these also regulated by the Act. In spite of the PNDT Act in 1994, not a single doctor was even booked, leave alone convicted. And so therefore in 2000, many of us who had been activists in the campaign had been part of the national and the state level acts, went to the Supreme Court and filed a public interest litigation against the Union of India. That was Masoom, my organization, Sehat in Bombay, and Dr. Sabu George. And the 3 prayers that we asked the court were: 1, why should we believe that the government was serious about the implementation of this act if no doctor was being booked? Secondly, why was the woman punished under the act? And thirdly, why were sex pre-selection techniques not included in the act?
Due to the efforts of the health activists, the 1994 PNDT Act has been amended. Various checks and stringent measures like compulsory registration of sonography centers have been introduced. Is legislation effective at all? The statistics do not indicate that. The child sex ratio has declined from 945 in 1991 to 927 in 2001. The Gokhale Institute of Politics and Economics in Pune reveals data which establishes the relation between increased use of technology and declining sex ratio.
We are a population research center in Gokhale Institute of Politics and Economics, and we receive grants from the Health Ministry for carrying out studies in the field of health, fertility, family planning, etc. In 2004, the Ministry of Health requested us to carry out a study of sonography centers in Maharashtra. This 4,400 centers in Maharashtra, actually the distribution is very uneven. 80%, nearly 80% of the centers are settled in Western Maharashtra, and the remaining Western Maharashtra, which means 8 to 9 districts, and the remaining around 25 districts have very little sonography centers are there. So you could see that there is a clear relationship between the development of the region and the availability of the sonography centers. Nearly 370 centers were surveyed. Out of 370, 70 were with the trained owner and the remaining were with the untrained owner.
When we interacted with the doctors in connection with this survey, we asked them whether couples come and ask you about the sex of the baby. But the doctor said yes, couples come and ask us about the sex of the baby. Then we asked them further that do you reveal the sex of the baby? But most of them said that no, but they asked, but I don't do, but there are other doctors practicing this in the same city, so I normally don't do. This is the common the response they give. But with our interaction, the doctors also told us that when the couples come with 2 daughters already, then we feel that we should help them.
Researchers, however, have pointed out that our population policy itself may have a negative fallout and affect the girl child.
When we discuss the issue of sex determination, there is one other slightly unrelated issue that we have to take cognizance of, and that is the enforced 2-child norm of the government. The government says that you cannot have more than 2 children. On the other hand, the family says that you must have 2 sons. And that's why we see a drop in the sex ratio. If the government knows that a family still ideally wants 2 sons, and if they are enforcing a 2-child norm, and they are not regulating the private sector that conducts sex determination tests or sex pre-selection tests, what did they imagine would happen in the past 20 years? And so therefore I would say that the government has been lax not only in regulating the private sector, but also in being insensitive to women's condition in this country.
The declining gender ratio is likely to have social ramifications too. The argument that the principle of demand and supply would enhance the status of women because they are less in numbers has proved to be false. In fact, insecurity will force men to keep women in their community indoors, thus curbing their liberty. It could lead to young women being forced to marry earlier. It would lead to an increase in crimes against women. This only forces the society back into medievalism. Can the girl child be saved? The government has taken some steps in this direction. But clearly, this is not enough. Much more has to be done.
If we really want to address sex determination at its core, then removal of discrimination and enactment of certain pro-woman acts in this country, first being the Child Marriage Restraint Act. If a girl is married at 16, it's very difficult for her to negotiate with her family that she doesn't want to undergo sex determination. The second is Prevention of Bigamy Act. Every 10th or 12th Hindu household in our area has a second wife, and this has to be completely stopped. And the third is the Prohibition of Dowry Act. It's because of the increasing dowry, it's because of the increasing expenses in marriage, and because quantity now is replaced by quality, therefore now you go in for sex determination. And so the reversal of discrimination is to give certain advantages to women who have not reaped the fruit of development, and then to find out how discrimination and technology and the provider are addressed, not the woman, her abortion rights and her lack of choice.
The girl child can be saved. Some states in India have already shown the way, like Kerala, which has the distinction of being the state with the highest male-to-female ratio of 1058. Two factors seem to have influenced this. One, large-scale people's social reform movements, and two, higher literacy and education among women. Female literacy in Kerala is 87.7% as against 53.7% in India. Earlier, doctors had tried to defend this malpractice under various pretexts.
I don't think there is anything wrong in conducting sex determination tests. It's one way of controlling population. You see, you restrict the number of women and you automatically control the future increase in population.
I don't see why we should not do these tests. After all, our patients want it, and we give our patients what they want. We are professionals, and it is not our job to take a moral stand on our patients' needs.
All this reasoning holds no ground. It is in fact they who first introduced this misuse of technology to people.
What I would like to point out that doctors can play a good and positive role in preventing this rot. There are two specific things that doctor can say. Number one, doctors can say that as per the Medical Council of India's directives and as far as the government's directive, this practice is not only unethical but is also illegal, and therefore I will not like to indulge into this kind of unethical and illegal practice. Secondly, doctors can also share some important health information and knowledge with the patient and the relatives, which has two components. Number one, doctors can convince the lady as well as her relatives that to beget a male child you require what we call Y chromosome, and Y chromosome can come only from the husband. No woman in the world has Y chromosome, and therefore if a couple is continuously begetting girl children, it is no fault of the lady altogether at all. The doctors' organizations should play a positive role. There has to be discussions amongst doctors within the organization about the social consequences of sex-related abortions, because doctors are very much confined in their small little clinic and hospital. They do not have much larger exposure to the whole issue of demography and how even in the advanced country states like Maharashtra, Punjab, Haryana, the sex ratio is going down. The figures, the statistics, the decline, all this is not generally discussed amongst doctor circles, and therefore if we have a good discussion with the help of some demographers or women activists who very clearly bring out the ill effects of sex-related abortions on the society as a whole, I think some amount of change in the heart or mindset of the doctors can also occur, and therefore such discussions on the various pros and cons of sex-related abortion needs to be discussed amongst the doctors' organizations. And there has to be a culture, or what I say peer culture within the doctors' organization, both formally and informally, that this practice of sex-related abortion is something which doctors' organizations would not consider as to be a good thing, and it is to be deprecated from within the heart.
It is an age where both the Constitution and civil society have recognized that women must have equal rights. The first step in this long journey is crucial. Stop killing the girl child. Give her the freedom to blossom.